So let me be very clear, and I'm sure the physicians who are up here will reflect this as well. The average American does not need to go out and buy a mask.
Should you wear a mask if you're healthy?
No.
Government officials say face masks are not necessary if you are healthy and don't entirely provide protection against the coronavirus.
Masks do not work for the general public in preventing them from getting coronavirus.
Right.
If you do not have any respiratory symptoms such as fever, cough, or runny nose, you do not need to wear a medical mask like this one.
And if you're not sick, you shouldn't be wearing a medical mask. But if you are, then you should.
We recommend that people who are sick wear a mask. We recommend that people who are around someone who's COVID positive wear a mask, but do not recommend that the general public wears masks as a protective mechanism.
WHO recommends that the wearing of a mask by a member of the public is to prevent that individual giving the disease to somebody else. We don't generally recommend the wearing of masks in public by otherwise well individuals because it has not been up to now associated with any particular benefit. It does have benefits psychologically, socially, and there are social norms around that, and we don't criticize the wearing of masks and have not done so, but there is no specific evidence to suggest that the wearing of masks by the mass population has any particular benefit. In fact, there's some evidence to suggest the opposite in the misuse or wearing a mask properly or fitting it properly or taking it off and all the other risks that are otherwise associated with that.
The masks are important for someone who's infected to prevent them from infecting someone else. People should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
From the data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a secondary individual.
But the one thing historically people need to realize, that even if there is some asymptomatic transmission, in all the history of respiratory-borne viruses of any type, asymptomatic transmission has never been the driver of outbreaks. The driver of outbreaks is always a symptomatic person. Even if there's a rare asymptomatic person that might transmit, an epidemic is not driven by asymptomatic carriers.
And I think, one of the important things that we're emphasizing right now is our insistence now on wearing masks.
Wearing a mask is not hard. Breathing through a mask is not hard.
You could literally kill someone because you didn't want to wear a mask. I mean, how cruel and irresponsible would that be?
I am placing the entire state of Utah under a mask mandate.
You need to be wearing a mask when you're around anyone who is not from your household.
It's no longer voluntary, it's mandatory.
No shoes, no shirt, no mask, no service.
All customers in retail facilities must wear a mask. In grocery stores, must wear a mask. In most forward-facing businesses, must wear a mask. If you are indoors, must wear a mask. And outside, must wear a mask.
There's no medical exception that applies or that allows you to insist on coming into a facility, a store and the like, without a mask, or insist on remaining in a store or facility without a mask. We have been communicating with law enforcement agencies as well, and they stand ready to assist if there's any trouble enforcing this face covering requirement. Anyone who still insists on entering a store or other facility without wearing a mask or insists on taking it off after getting inside, they can be and should be removed and charged with criminal trespass.
But any business that refuses to go along with the new mandate could face closure, fines, even jail time.
So we have 39 police officers that are dedicated specifically and solely to issuing mask violations. We've also been closing of businesses. We closed over 30 businesses that are not following the coronavirus guidelines that we've set out for businesses, social distancing, have too many people, have maybe violated the curfew, etc.
This is much like enforcing a seatbelt violation or someone that ran a red light. It's the new normal. We have to do it.
Police are under investigation over the handling of a confrontation with a woman caught without a mask.
Abide by the public health measures that we talk about all the time: uniform, wearing of mask, physical distancing, washing your hands frequently. We just have to keep doing that.
One mask at least, but if you want to really be sure, get a tighter fit with the second mask.
So wait a minute, are you a double masker, Dr. Fauci? It looked like you are.
President-elect Joe Biden does it. Mitt Romney double masked during the Capitol insurrection. Tom Cruise also double masked.
The new White House press secretary wore the same just today, and doctors say they're onto something.
Doubling up may be one of the safest ways to stop the spread, as many Americans desperately wait for their shot at the COVID vaccine.